I'm a general practitioner from Iran, and I used to work as a family physician and emergency physician for 7 years in Iran. What does medicine mean to me? There are two aspects of medicine that I love, and I know it's challenging to get into a med school. Even graduating from it is challenging, but I think these two aspects will motivate. It has motivated me, and I hope it will motivate you to continue. One is the pleasure of making a difference in people's lives by helping to alleviate their pain. You know, people come to you, they are in pain, they are in fear, they don't know what's going on in their body. And you remove the pain, you will educate them, and you will treat them. You see the appreciation in their eyes and the happiness that you have brought to the family. It will make your day. It works for me and it recharges my batteries. The other thing, which is my personal interest, is I love solving puzzles, and sometimes to reach a diagnosis, one needs to work like a detective. And there are many symptoms and signs. You should know which one is related to the diagnosis, which one is not. Sometimes it's really challenging, but the moment you reach to the correct diagnosis, uh, the feeling is so rewarding, and it will remain with you for a long time. I just want to tell you guys that I know it's challenging and hard. Don't get disappointed because something awesome is waiting for you down the road. Okay, today I'm going to talk about one of the eating disorders, which is bulimia nervosa. It's a Greek word. In Greek, bulimia means ravenous hunger, and nervosa means nervous. So it's nervous, ravenous hunger. It is episodes of binging, purging behavior, and the most common age of onset is between age of 12 to 25, and it's 10 times more common in females than males. So the most common patients are adolescent girls, and if you see a teenage girl with the symptoms that I'm going to explain in next slides, just just be aware and try to convince that person to seek help. It starts with binge eating. Binge eating is eating a significant amount of food in a limited time. Binges can happen with any type of food, but most commonly it occurs with foods that the individual would usually avoid, such as fast food, ice cream, cake. After that, they experience feeling of guilt or shame or anxiety about what they have eaten. And they are already preoccupied with their body shape or weight, although they are in a normal body weight or in a normal body shape. But they think otherwise, they think they are fat, and no one can convince them. Then we go for purging. Purging is some form of inappropriate compensatory behavior. The most common one is forced vomiting. Some other people go for fasting, long fastings. Some do drugs such as laxatives, diuretics, enemas, and some do excessive exercise. There are a few that do all of them together, which can cause a severe imbalance in levels of electrolytes and can cause stroke or heart attack. So it can be fatal. For diagnosis, the diagnosis is based on history and physical examination. Remember, for diagnosis, it should be continuous. The episodes of binging and purging should happen at least once a week for 3 months. And remember, the patient's BMI should be in the normal range. If it's under normal or above normal, it falls into other categories of eating disorders. There are some signs that can help to diagnose. One is Russell signs. The knuckles of the hands are thickened because of repeated self-induced vomiting. So they put their hand in the mouth, and just the knuckles are in touch with the roof of the mouth and the teeth. So gradually they become thickened. The other thing is they lose their dental enamel, and their teeth get discolorated, and they have a lot of dental caries because when they vomit a lot, the stomach contents are acidic, so they can just damage teeth. Psychotherapy is the best treatment. And we have different kinds of psychotherapy, but the most effective one is CBT, cognitive behavioral therapy. There is a circle of thoughts, feelings, and behavior, and the therapist try to make the patient aware of this circle and help them to stop this circle. If the psychotherapy doesn't work, the other treatment which is not as effective as psychotherapy is antidepressants, and the most effective one is Prozac. That is the end of my presentation, and I hope everyone enjoyed it, and if there's any question, I'm here.
Thank you. Thank you, doctor. Is anybody prepared to go to the next presentation? So who is left? I think Dr. Anuba is not here and Dr. Hadir are not here. We have Dr. Sarwar. Is Dr. Sarwar here? I think not. Right. So Dr. Farah already presented. So I think that we are done. We are done.
No, it's my turn. I'm Dr. Angela.
Sorry, who is that?
Dr. Angela is here.
Oh, sorry, Dr.
Yes.
So let's start.
Okay, thank you so much. Just give me a second to share my screen.